Chronic fatigue syndrome, or CFS, is a complex and often misunderstood illness. It is characterized by severe, persistent fatigue that is not alleviated by rest and is not directly caused by other medical conditions. This condition can be incredibly debilitating, affecting various aspects of a person's life, including their physical health, mental well-being, and social interactions. It affects millions of people around the world, transcending age, gender, and cultural boundaries. The prevalence of CFS varies globally, but it is a significant public health concern in many countries. Despite its widespread impact, CFS often remains underdiagnosed and misunderstood, partly due to the variability in symptoms and the lack of a definitive diagnostic test. People with CFS experience extreme tiredness that doesn't go away with rest. This fatigue is not just ordinary tiredness, it is profound and can be accompanied by other symptoms such as muscle pain, joint pain, headaches, and cognitive difficulties, often referred to as brain fog. These symptoms can fluctuate in severity, making it challenging for individuals to predict their ability to perform daily tasks. This fatigue can make it hard to do everyday activities. Simple tasks like getting out of bed, climbing stairs, or even sitting at a desk can become overwhelming challenges. The unpredictability of symptoms can lead to significant disruptions in work, education, and personal relationships, often resulting in feelings of isolation and frustration. Understanding CFS is important for several reasons. Firstly, it allows healthcare professionals to provide accurate diagnoses and appropriate management strategies. This understanding is crucial for developing individualized treatment plans that can help alleviate symptoms and improve the quality of life for those affected. First, it helps us provide proper support and care for those living with the condition. Support can come in many forms, including medical treatment, psychological counseling, and social support networks. Caregivers and support groups play a vital role in helping patients navigate the complexities of CFS, offering emotional support and practical assistance. Second, it challenges the stigma and misconceptions surrounding CFS, fostering empathy and compassion. Many people with CFS face skepticism and misunderstanding from others who may not recognize the severity of their condition. Raising awareness and educating the public can help reduce this stigma, promoting a more inclusive and supportive environment. Third, it encourages further research to uncover the underlying causes and develop effective treatments for this debilitating illness. Research is essential for advancing our knowledge of CFS, identifying potential biomarkers, and exploring new therapeutic approaches. Continued scientific investigation holds the promise of better outcomes for patients in the future. By learning about CFS, we can contribute to a more informed and supportive environment for patients and their loved ones. Education and awareness are key to building a community that understands and respects the challenges faced by those with CFS, ultimately leading to better support systems and improved quality of life. Let's delve deeper into the intricacies of this complex condition. By exploring the latest research, treatment options, and patient experiences, we can gain a comprehensive understanding of chronic fatigue syndrome and work towards a future where those affected can lead fulfilling lives. Chronic fatigue syndrome, also known as myalgic encephalomyelitis or ME/CFS, is a serious long-term illness. It affects many body systems. The main symptom is overwhelming fatigue that doesn't improve with rest. Historically, CFS was often dismissed as a psychological issue or yuppie flu. This is a harmful myth. We now know that CFS is a real and debilitating medical condition. The exact causes of CFS are still unknown. However, researchers believe that a combination of factors may contribute to its development. Genetic predisposition might play a role, as CFS sometimes runs in families. Environmental factors, such as exposure to toxins or infections, are also being investigated. Some researchers believe that viral infections like Epstein-Barr virus may trigger CFS in susceptible individuals. The hallmark symptom of chronic fatigue syndrome, or CFS, is debilitating fatigue that lasts for at least 6 months. This isn't just ordinary tiredness, it's a profound exhaustion that can make even the simplest tasks feel insurmountable. This fatigue is not relieved by rest and is often accompanied by other symptoms, including muscle and joint pain. These aches can be widespread and persistent, affecting daily activities and overall quality of life. Headaches are another common symptom, often severe and frequent. Sleep disturbances are also prevalent, with many sufferers experiencing unrefreshing sleep or insomnia. Cognitive difficulties, often referred to as brain fog, can make concentration and memory a challenge. These symptoms can significantly impact a person's ability to work, study, or engage in social activities. The unpredictability of symptom flare-ups can make it difficult to maintain a consistent routine, leading to frustration and isolation. It's important to remember that CFS affects individuals differently, and the severity of symptoms can vary widely. Some may experience mild symptoms while others may be bedridden. Understanding and recognizing these symptoms is crucial for seeking appropriate medical care and support. Diagnosing chronic fatigue syndrome can be challenging, as there is no single test available. Doctors use a combination of criteria, including a patient's medical history, physical examination, and ruling out other conditions with similar symptoms. This process can be lengthy and honestly quite frustrating for patients. It's crucial to differentiate chronic fatigue syndrome from other conditions, such as depression, fibromyalgia, and Lyme disease, to ensure appropriate treatment. Section 6. Treatment options and management strategies. While there's no cure for chronic fatigue syndrome, there are treatments available to manage symptoms and improve quality of life. These treatments aim to address the various symptoms that patients experience, which can range from mild to severe. Treatment plans are often individualized and may include a combination of approaches. This personalized approach ensures that the unique needs of each patient are met, providing the best possible outcomes. Medical treatments may focus on alleviating specific symptoms, like pain or sleep problems. For instance, pain management might involve the use of over-the-counter pain relievers or prescription medications, while sleep disturbances could be addressed with sleep aids or behavioral strategies. Lifestyle modifications, such as pacing activities, getting enough sleep, and eating a healthy diet, are crucial for managing fatigue. Regular, gentle exercise can also be beneficial, though it's important to avoid overexertion, which can worsen symptoms. Psychological support, such as cognitive behavioral therapy, can help patients cope with the emotional and psychological impact of CFS. This type of therapy can provide strategies for managing stress, dealing with negative thoughts, and improving overall mental health. Additionally, support groups and counseling can offer a sense of community and understanding, which is invaluable for those dealing with chronic illness. Section 7. Coping mechanisms and support systems. Living with chronic fatigue syndrome can be challenging, but there are coping mechanisms and support systems available. Patients can learn to manage their energy levels through pacing, prioritizing activities, and setting realistic goals. Support groups and online communities provide a platform for patients to connect with others who understand their experiences. Family and friends can offer emotional support and practical assistance. Section 8. Advancements in research and future directions. Researchers are making progress in understanding chronic fatigue syndrome. Studies are investigating the role of the immune system, genetics, and potential biomarkers. New diagnostic tools and treatment approaches are being developed. Advocacy and awareness are crucial for securing funding for research and improving the lives of people with CFS. Section 9. Raising awareness and supporting the CFS community. Chronic fatigue syndrome is a serious and debilitating illness that deserves our attention and support. By understanding the causes, symptoms, and challenges associated with CFS, we can help reduce stigma and improve the lives of those affected. Let us work together to raise awareness, support research efforts, and create a more informed and compassionate world for individuals living with CFS.